So bioidentical hormones are a pretty big topic, and the alternative hormone industry is huge, and we all see patients who have gone down this route. And actually, these are statements that my patients have made to me over the last month as they go down the alternative hormone route. And your heart kind of sinks a bit because you know that what's coming for the rest of the consultation. My favourite one was a few weeks ago. I hate my husband and it has to be a hormone problem, and if you could just solve it, it would be a good thing. And you kind of know that you're not going to make an endocrine diagnosis, but these patients are really suffering. And they've gone down all sorts of routes, and they've consulted the woman at the golf club and all sorts of things. And bioidentical hormones and natural hormone specialists do advertisements like this, and this looks really reassuring. This looks really professional and really reassuring for women. And they've spent a large amount of money, and they've often had salivary hormone tests, and they've been given a range of diagnoses. And the bioidentical hormone industry is an extremely lucrative industry. So what are they, and where did they come from, and how did they get so big? So bioidentical hormones are a marketing term. They're brought about by compounding pharmacists. And back in the 1990s, compounding pharmacy was pretty small. So it would do things like make a tablet into a liquid if we had a patient that couldn't tolerate oral tablets, or a patient with a nut allergy, they might remove the nut oil from a medication. And they compound and mix together various medications in that way. But then after WHI was published, and I'll talk about the marketing in a moment, they started to put together custom compound preparation of hormones and market these as being exactly the same as the hormones that your body produced or produces, and therefore must be safe. It's a marketing term, it's not a scientific term, and these medications are not FDA approved. They're not subject to the same regulations that MedSafe put on the medications that require a medical prescription that we prescribe, and they are not subject to the same scientific rigour. They're marketed as health products. So the WHI trial created an opening. After what we've just shown you this afternoon, these women were scared, but they were symptomatic, and they were looking for things that were going to make them feel better. And this woman, Suzanne Summers, came along, who was an actress, or is an actress, and as far as I know has no medical degree, but has had some phenomenal marketing around her, and she's published several books in this area. Books called The Sexy Years, fantastic titles, and she's made statements like this: I get my hormones compounded, and there's not too much, there's not too little, there's a dose that is just right for me. And she says that you must find cutting-edge doctors who are prepared to work with you and do regular hormone testing and adjust things. And in 2009, she went on Oprah, and of course gained a huge amount of publicity, and the bioidentical hormone industry is now worth a phenomenal amount of money in the States and also in the Western world. So what's being used? Well, there are estrogens and progesterone. There are biased estrogens and triest estrogens, but actually the most potent estrogen in either of these is estradiol valerate, exactly the same estrogen that is in Progynova or the Estradot patch. There are some other weaker estrogens added in, and these are put together in a troche that you wear just under your lip, and it slowly dissolves over 2 or 3 hours. Thankfully, it seems to me there is less progesterone cream being used with the bioidentical estrogens, because the progesterone cream isn't absorbed, and the Australasian Menopause Society published about 7 or 8 years ago the cases of endometrial cancer that were being diagnosed in this situation. So there seems to be a move to use more micronized progesterone, exactly like Stella was talking about, and we're very pleased to see that because there's good data to show that that's protective with regards to the endometrium. But progesterone cream is still being used to treat PMS, to treat PCOS, to treat aging, to treat all sorts of things. Testosterone cream, compounded testosterone cream, DHEA, pregnenolone, whole thyroid, pig thyroid, they are all being used. It's natural. Why do we worry about it? You know, what's the concern? And you hear people say that all the time. It's natural. It can't be harmful. Well, the concern is there's no randomized controlled trials of any of these products. When we write a prescription, we have to be able to supply patients with information about what we're prescribing, and we have to be able to supply patients with information about risk. And if you can't do that, and if there is a complication from that product, you're medico-legally responsible for that. Salivary levels are completely inaccurate, so salivary hormone testing is not useful. Depends on whether the patient cleaned their teeth that morning, what they've eaten, if they're dehydrated. They're expensive. We've got serum testing. It's not costing the patient anything. It is extremely accurate. Salivary hormone testing is hopeless. And of course, we don't use hormones to monitor our HRT. We use patients' symptoms to consider doses of estrogen and bleeding to consider doses of progesterone. We don't monitor with hormones. Quality control is the major issue. So in 2003, the FDA looked at this. They took 29 products from 12 different pharmacies and they tested them compared to the FDA-approved products to make sure that what was on the packet was actually what was in that troche, and a third failed quality testing. In 2012, the American More magazine, so there is a fantastic article here, online, open access, which you can refer your patients to, that's called The Hormone Hoax That Thousands Fall For, published by the American More magazine. I give you that reference at the end. It actually won, I think it won the 2013, but it might have been 14, Scientific Award for Lay Scientific Publications, and it provides a very good oversight into all of the issues that I'm running you through now. So what this journalist did was that they commissioned an external laboratory to look at different bioidentical estrogens and progesterones, and they tested them. And in fact, actually 10 of the 12 showed different estrogen doses to what was on the box, and most of them had inadequate progesterone added into that estrogen. In 2012, the New England Compounding Centre in the States was closed because it shipped out several non-steroidal intraspinal injections. There were lots of fungal meningitis diagnosed and 64 deaths. So there's real dangers from these natural products. These are cases that we've experienced. So we published this case a long time ago now, 10 years ago. This was looking at compounding testosterone creams. We published 2 women. This was one of them. So 60-year-old woman presented with 18 months of acne. She had had her hysterectomy, BSO, about 10 years ago, and she was prescribed compounding testosterone cream that she was applying to her clitoris every day. She was slightly virilized on examination, and she had well into the male range with her testosterone levels. We were worried about malignancy and scanned her, and all of that was normal. And when she stopped her testosterone cream, she was well back into the normal female range within a couple of months. This is the other concern regarding progesterone creams and endometrial hyperplasia. This was a 59-year-old woman who had been on HRT since the age of 33 when she had her bilateral oophorectomy for her dermoid cysts. About somewhere along the way, and from memory it was about 15 years prior to this presentation, she had swapped over to a Climara patch and had been given progesterone cream by a practitioner, and she presented to me with dysfunctional uterine bleeding. She had a thickened endometrium on pelvic ultrasound scan and complex endometrial hyperplasia on her biopsy. And then this was Stella's patient who presented to her way down here, but the background to it was that she was 49 years old and presented to an alternative hormone practitioner complaining of tiredness and weight gain. And she was placed on whole thyroid because of her TSH of 5, and she was sent away without any monitoring. And she presented to North Shore Hospital not feeling very well and went into ventricular tachycardia in the emergency department. And she was clearly hyperthyroid when she actually recovered, was sent to Stella, and her TSH was 2.4 off all medication. She started some hormone replacement therapy and felt a lot better 3 months later. So these are difficult patients to see. They make us feel all sorts of things, actually. They make me feel defensive, and they make me feel grumpy and irritated and like I have to defend my position. And I think we find them quite difficult to deal with. I think if you can listen to patients for as long as possible, and as we've said all day, we have a little bit more flexibility to do that, but listening to patients as long as possible and understanding what they have come to you for makes a big difference. Educating as much as you can. I send patients to read that More magazine article all the time, but there are also good statements on bioidentical hormones with the American Endocrine Society, the Australasian Menopause Society, and we have those printed out in our rooms and hand them out. And actually, for a standard menopause consultation where we're deciding around HRT and the patient brings up bioidentical hormones, we all give them one of those statements and say, there you go and read that. Now let's come talk back and talk about HRT, because this can be a very time-consuming consultation. Often patients won't disclose, and so actively asking about supplements and other things are really important. And of course, it's always easy to be anxious that you're going to miss something with these patients. So thinking about sensible investigations is always important. Okay, so discussing the evidence, telling people that there is no evidence to support their salivary hormone testing, and let's actually do some real serum hormone testing if we need to and see what's actually going on. No safety data for these products, and understanding that these are all active products, and all active products have side effects and risks. We have very well-researched medications. Our HRT regimes, levothyroxine, are very well-researched, and we can be very clear to people about benefits and risks. And there are a large amount of funded options. It's amazing how much money people are spending going down this route. To be slightly pragmatic, we also need to be looking at what's doing people harm. So changing the progesterone cream, if it's being used to oppose estrogen, is really important because that will put women at risk. Stopping whole pig thyroid if there's no evidence that that patient has been hypothyroid on previous blood tests is also really important because that's going to put that patient at risk. But at the end of the day, it's the patient's choice, and we can't absolutely influence that. So looking at what will do harm and giving out the information, but at the end of the day, the patient has to choose. So we've got no evidence to support safety or superiority of compounded hormones. We've got very good FDA-funded products that we can be very clear about benefits and risks. It's very possible that compounding products can provide extra risks for patients. And salivary testing is not evidence-based. And that's the reference that I talked to you about that is freely online.